We get this question a lot, so since we're recording, we thought, hey, let's record a thing about this. What happens when you put the Peli lens in both eyes? Because the patient's affliction affects both eyes, so why wouldn't you put the solution or the help in both eyes? You have two eyes, and when you have homonymous hemianopia, it cuts the vision out of both eyes. Now, what you're left with is you have half vision in each eye. What the Peli lens does is it expands the visual field to the blind side. That's our goal. Now, the question is, when we expand visual field, what are we actually doing? And it gets a little bit confusing because when we do visual field tests, we do monocular visual field tests, right? So we'll do a right eye test and a left eye test. And if you look at each eye individually, what's going to happen is you'll get a picture of what they see with each eye individually, but it doesn't necessarily capture what the patient sees with both eyes together. Now, if you put a Peli lens on one eye, what's going to happen is that, let's say they're a left hemi, just to be very literal about this. So let's say that they're blind on their left side, and you only put the peripheral prism on their left eye. So what we're going to do is on the left eye, we're pulling information from the blind side into the seeing side on the left eye. Now, when we place those prisms, where is that information coming from? It's coming from over here, but it's going here. And when it goes here, the information that was there is no longer gone. So if we were to do a visual field test on that patient and that eye, what you would see is a big hole. You would see a big hole in their visual field, and then you would see the expansion out to the sides in that eye. Now, the other eye, what you would see is a normal field. So let's talk about that in the context of putting a Peli lens on both eyes. Now, when we put the prism in both eyes, what we're essentially doing is we're pulling expansion on both eyes and leaving a hole in the same spot on both eyes. So when we leave that hole, we're creating what's called a scotoma, which is basically visual field loss. So when we put two in, we're gaining field to the blind side, but we're stealing field from the seeing. By doing it in just one eye and not the other, we kind of get the best of both worlds, where the one eye will see straight ahead and then the other eye will see off to the side. So the binocular visual field, when you just fit one Peli, is larger than when you fit it on two.